Okay, so here's a tough one, Romney. If it's the performance of AST for non-Cepacia complex Burkholderia species known to be better. So we know it's a problem for Cepacia. What about other Burkholderia species? Are there data showing that it is safe to use the non-Enterobacterialis breakpoints for non-Cepacia complex Burkholderia, especially considering the difficulty in reliably identifying Burkholderia to the species level?
Yeah, this is a great question. And I think the answer is we don't know. When the CLSI group, which was led by Holly Hughes, took a look at the test methods, they did include some non-CF isolates. Actually, it was like a 50-50 mix, and performance was kind of equally bad across the board. That being said, we do think that likely the MIC correlate to outcome might be a little bit different in non-CF patients. And so there's more information, kind of being looked at for that. I can tell you in my lab, our game plan is for these non-CF patients, we'll have the isolate tested by reference broth microdilution and report out without an MIC, but lots of conversation with an MIC, but no interpretation, lots of conversation with the clinicians. And I think this will be easier once the lyophilized BMD panels are validated by the CLSI group for Burkholderia cepacia. As I mentioned, it looks kind of good, still too early to tell for sure, but promising so far. So hopefully there will be accessible methods for labs soon.
So another one that I know a lot of people are thinking about right now, they've been testing Burkholderia, for example, on their Phoenix system. So what would you suggest they do at this moment?
Yeah, so at this moment, I think it's time to have a conversation with your CF physicians if you treat CF patients at your institution. I had one with mine and they said, oh yeah, we've been talking about this on our society level too. So hopefully it doesn't come out of left field for them. Hopefully they've heard this. And hopefully, it won't be such a difficult conversation. But if I were you, I would stop testing on my automated system because really it looks like there's no good data to show that any of these commercial methods actually give a reproducible or accurate result. And it's important to just highlight some of the consequences can be severe. And so having Burkholderia cepacia that's very drug resistant can be a reason to be denied a lung transplant. And how horrible would it be if that was due to an inaccurate result? So really, have some robust conversations with your clinicians about it.
Okay, in the next 10 seconds, Romney, I know this is another very tough question, but I know it's on everybody's mind. Where should we send Burkholderia if a provider requests susceptibility testing? Do any reference labs currently perform frozen broth microdilution?
Yeah, I don't know. So I think that many of them are looking at what the options are. And I think, again, having those lyophilized BMD panel data will open up the door to that reference lab testing. I think the biggest thing to do as a lab is reach out to your reference lab, ask them specifically what method they use, and kind of go from there. I know that ARUP, Mayo are all looking at these. I'm not sure that LabCorp and Quest will be doing it. But again, the best way to get that information is to talk with them directly.